Hello, I'm Dr. Travis Hunsaker with Hunsaker Dental, and today we're here to talk about what to expect after a tooth extraction. The most common question that people ask about a tooth extraction is, how long is it going to hurt for? The short answer to that question is it's going to be sore for about a week, give or take a little bit depending on how you heal and depending on your pain threshold, but it's expected to be sore for about a week. How am I going to cope with that discomfort? Rest assured that a tooth removal is, while it's going to be sore, it's not going to be anything incapacitating. So it's not going to leave you in bed for a whole week or anything like that, but it is going to be a little tender. So some things to be aware of: consult with your doctor, number one. A lot of times the doctor will prescribe you some pain medication to help you get through it or give you a recommendation. At Hunsaker Dental, what we do here is we always recommend over-the-counter pain medications in addition to whatever we prescribe. In a normal healthy adult, 3 ibuprofen, which is 600 milligrams, in conjunction with 2 Tylenol, which is 1,000 milligrams of acetaminophen. In combination every 6 hours is what works the best. Consult with your doctor to make sure that's right for you. Next question that people ask is, how long does it take to heal? When we remove a tooth, we do have to let the gum tissue and the bone that was once in that area heal up, and it takes some time for that to happen. Everybody heals differently, but in general you can expect the soft tissue or the gums to heal up over that area within about 3 or 4 weeks, and then it's going to take about 3 or 4 months for the bone to really heal up into that area and really become dense enough for us to replace that tooth that's missing now with a dental implant. One of the most common post-operative questions that we get about tooth extractions is, what is this little white thing that is where the tooth was? A lot of times we get a little flake of bone that works its way out where the tooth was, just from the trauma of having the tooth come out. A lot of times it can dislodge a little flake or sliver of bone. It's not anything major. In fact, a lot of times just by coming in, we can almost with a pair of tweezers just remove it. In fact, a lot of times it's not even necessary to come in for that. Given a day or 2 or 3, a lot of those will resolve themselves, and that little sliver of bone will just work its way out. If you think you have an infection or some kind of complication with the tooth extraction site, you should contact your doctor. If you notice any pus or drainage from the extraction site, not just blood. If you do have a little bit of bleeding, that's normal for several days after the extraction. In fact, a little bit of blood can mix with your saliva and make it look like a lot of blood. However, unless you can actually see the blood oozing out of there, it's usually not a problem. In fact, a lot of that can just be resolved with some direct pressure with some gauze. When we remove a tooth, we always send our patients home with a big stack of gauze for just such an occasion. Another thing you should be aware of with tooth extractions are dry sockets. Dry sockets are an area where the bone is exposed to the air. It causes an inflammation of the area, and it can be a little bit painful. Most of the time that happens about a week after the procedure was done, and it usually only lasts a couple of days. If you do have that, contact your doctor. There are ways that we can make things a little more comfortable for you while things are healing up. One other reason that you might want to contact your doctor after you've had a tooth extracted is if you're running a fever. If you notice that there's any kind of infection, pus or drainage like mentioned before, you really should contact the doctor to see if an antibiotic would be appropriate for you. Another common question that people have after a tooth extraction is, what can I eat? A lot of people will think that they can only eat the soup, for example, but you can actually eat normal foods pretty quickly. You just want to steer clear of foods that will gouge the area. If you have any sutures that were placed, you don't want to eat tortilla chips or anything like that that's going to gouge the area or get caught on a suture or anything like that. So, don't forget to check out our video on dental implants. That's the best way to replace a missing tooth. Thank you for watching this video. I hope it provided some valuable information for you. Don't forget to like, comment, and subscribe to our channel. And let us know what videos you want to see in the future. If you have a question that you'd like to have answered, let us know in the comments below.